Kick off. Got it. All right. So it looks like we're also live on Facebook. So just want to say welcome everybody. Thank you so much for taking the time and joining us this Saturday morning. I know you've got other things to do, but I really appreciate bringing the community together. And as I was just telling a minute ago, we've been doing these community conversations now since January. So this would be our 9th one. And I am really excited today to welcome Ann Lucena, who is the CEO of San Ramon Regional Hospital. We are very fortunate to have San Ramon Regional Hospital here in San Ramon, and I will let Ann talk a lot more about, you know, how the hospital works with the city, what her role is. What we also like to do, if any members of the community would like to introduce themselves before we kick off the panel and talk about why they're interested, what their role has been, we'd love to do a roundtable. So would anybody else like to introduce themselves and, you know, why you decided to join the panel and what you do here in San Ramon?
I can go first, Sabina, if that's okay.
Of course. Yes, of course.
I'm actually sitting in the parking lot of the senior center today, working on my garden at the in the plot that I bought there. I'm a resident of San Ramon, and I work with Sabina a little bit on her communication campaign. And I did go to San Ramon Regional for an accident I had on my forehead, and took care of me, and you can't even tell. Scars doesn't even show. So thank you for that care. That's it.
Thank you, Ava.
Thank you.
Anybody else? Joyce or Stella? Yeah, Joyce.
Yeah, sure. I'm Joyce Gunn. I'm the retired manager from the San Ramon Libraries, and have used San Ramon Regional for multiple things and always got great care. And I think they were always a big supporter of the libraries, I know, and I assume still are, and longtime resident here. And it's just one of the best places to live.
Thank you. Stella.
Hi, okay, so I'm Stella. I know Sabina from AEW, and I know the hospital because I was there a couple of years ago while Ann was a fresh director there, and was taken very good care of. I no longer have problems. They took good care of me. So I'm talking to you from home, and I have been a resident of San Ramon for 46 years, and I love it.
Wonderful. Would anybody else not on camera would like to introduce themselves or share why they joined the panel? And if not, then we'll give the mic over to Ann. And I know you a little bit, and I've been just amazed by not only your journey as a CEO, a young CEO of our hospital, but how amazing you are at your job that you do. So why don't you share with us a little bit about your journey and how you came to be the CEO of San Ramon Regional?
Great. Well, it's an honor to be joining you. Thank you so much for the kind invitation, Sabina. And it's always the best part of my job is hearing the stories from community members who've had, you know, a positive experience or somehow been touched by their experience at San Ramon Regional. So I'm just honored to be a small part of that. And thank you for sharing. You know, I think that community hospitals are really one of the pillars of a community, just like the city government, just like the fire department, the police department, the libraries, the schools. And so it's really a pleasure and a thrill to be in such a great community. And I agree with you, San Ramon is one of the, you know, jewels of the whole state and the whole country. And so we're very, very fortunate to be a part of this community. And thank you for sharing your experiences. So I'm from the Bay Area originally. I'm actually from the South Bay initially, but I came to San Ramon Regional Medical Center in 2012 for the first time, and I started as an associate administrator in the hospital. I learned a lot from my predecessor. Many of you may know him. His name is Gary Sloan, and he was the CEO at San Ramon for many years. And so he was a mentor for me and really helped teach me a lot about the hospital and healthcare in general. And I became an associate administrator at the hospital, where I learned about a lot of the operational departments, a lot of the behind the scenes work that happens to make sure that good care is provided to the community. And I just fell in love with it. And so I grew within the hospital. I spent a couple years in Dallas at the headquarters of the organization that runs Tenet Healthcare. It's called Tenet Healthcare in Dallas. But just for a couple of years, and I came back to San Ramon in early 2018 to be the CEO when Gary retired. And it's been such an honor to be a part of this organization since. I certainly didn't anticipate COVID, and being in a hospital during a pandemic is a different experience than it's been for anyone who's been a CEO in a hospital previously. But I'm very fortunate to have a great team and really committed clinicians and amazing nurses, doctors. All the medical staff are phenomenal. And then we have such a supportive community. And so all of that's really helped to make this last 18 months or so as bearable as possible, given that it's been a very difficult time. But I'm happy to share some updates about the hospital and how COVID is going as a whole in our county. And Sabina, tell me if you'd like me to stop for questions in between, or just kind of leave it until the end.
Keep going. I mean, whatever you want to share. It's really an open conversational panel. So
perfect. Okay, well, first I do want to talk a little bit about some of the trends that we're seeing in the county, just up to speed on what is happening around us, and then I'll talk a little bit about the hospital in particular. So at the county-wide level, we've made a lot of progress in the last 2 to 3 weeks. So as of yesterday, the number of positive cases in the county has dropped 31.5% in a 2-week period, which is very encouraging. And the hospitalization rate has dropped 16.8% in the last 7 days. So that's a really encouraging thing. A 16%, almost 17% drop in hospitalizations in 7 days is definitely going in the right direction. As a county, we are at 85.8% vaccination rate for anybody over the age of 12 who's received at least 1 dose of the vaccine. That's really leading most of the state and leading the country. I think the national rate is at 74.9%. So it's encouraging to see that we are, really ahead of the curve. And I do think that that's really contributing to the decrease in COVID cases recently. So as far as the hospitalization rates, if I can share my screen briefly, show you a couple slides. I didn't originally plan to share slides, but I think it's a little easier to see some of this in a slide format.
Or do you need to give you access?
Let me see if this will let me do this. Are you able to see this right now?
Yes.
Okay, so it's basically, I just wanted to share a couple slides. This is showing you the vaccination rates and the current active number of cases in the county. You're still seeing this, right, Sabina?
Yeah, I can see it.
Okay, perfect. And so this is all an encouraging trend. I think that you can see it here. This is the case rates for fully vaccinated versus unvaccinated individuals in Contra, Costa. So case rates means that someone's tested positive. It doesn't mean that they're necessarily in the hospital, but you can see that for the most part, those individuals who are vaccinated are having fewer cases of testing positive. We did see a significant increase around the end of July through, kind of the early September period. And we still haven't completely flattened out again, but you can see how the curve is a lot lower and much flatter than the curve for the unvaccinated population, which is why there's so much of an effort and push right now for vaccination as much as possible. This is also from the Contra Costa County dashboard. And so they're reporting the case rates by age group. And you can see that there are some age groups that are testing positive at much higher rates than others. Not surprisingly, the 5 to 12 age group is one of the largest far. They're not. Sorry, if you wouldn't mind muting yourselves, that would be great. Thank you. The 5 to 12-year-old population is still not eligible for vaccination. And with schools opening again, I think that's really contributing to a little bit more of an increase in positivity rate. Fortunately, at least at our hospital, we haven't had any hospitalized children come through. And so I think that a lot of the children who are testing positive, it's very, it can be scary, but fortunately, most of them are not requiring hospitalization, but they are testing positive at a higher rate. And you can see some of the other age groups that are also having different rates of positivity rate across the board. And then here's the hospitalization rate. Obviously, this is something we pay close attention to in the hospital. This represents all the hospitals throughout our county. And so you can see that we experienced a very significant surge as a county, again, starting towards the second half of July all the way through early September, and we're finally starting to see the downward trend. But this is very similar to the experience that we've had at San Ramon Regional Medical Center as well. Let me see, how do I stop sharing my screen? Here we go. Okay, so at San Ramon Regional, we've seen a very similar trend to the ones that I was showing you on the graph. At the height of this COVID surge, we were probably at around half of the patient number of positive patients that we had back in December and January, which is a very significant surge given that back then there was no vaccination of the population. So it was very concerning to see such a high surge with a high rate of vaccination in our community. Fortunately, I believe yesterday we have only 2 COVID positive individuals in the hospital, I believe. So it's been a very encouraging trend down in the last few weeks. And we're hoping that that'll be a continued trend. Unfortunately, we can't say it's over. And I think that what we've learned from this last surge is that we can't be too confident because this virus does keep on evolving and mutating. And while the vaccine is still a very effective tool, it's not going to allow us to just take everything for granted and be super confident. We still have to take precautionary measures. I still really encourage masking whenever possible. Within the hospital, we are all still required to wear masks at all times. And I think that's one of the best ways we can continue to prevent the spread from occurring. I did want to talk a little bit about the booster vaccine, because that's obviously the new topic that everyone's very excited to hear about. So just this week, the FDA authorized the use of the COVID Pfizer booster vaccine, specifically just for a couple of populations. So it's for individuals who are over 65. It's for individuals who are immunocompromised or at risk for a severe case of COVID-19. And it's for individuals who work in high risk settings, occupational settings, for example, healthcare workers. They are the eligible populations. There had been a lot of debate about whether it's going to be open to the entire population. And for now, they're taking this sort of intermediate step just for these populations. It's also important to note that it's authorized after 6 months of completion of the primary series. So if you got your first vaccine in July, you shouldn't be getting your second one now in September. You should wait until the 6-month period is done before getting the booster. That's the way that it's been authorized. I do get a lot of questions about whether you should mix and match vaccines. So my understanding is that this booster is authorized regardless of which dose you received first. So for example, you got Moderna 6 months ago, there is nothing prohibiting you from getting the Pfizer this time. I know some people are leaning towards keeping with the same dose or same brand they got the first time, but there hasn't been any sort of specific instruction or guidance that you have to stay with the same brand that you initially got. And some people I think are interested in getting the other one just for diversification purposes. So I think it's more of a decision that each individual will make. And if you have any questions, obviously you can talk to your primary care provider for their advice as well. The other thing people are asking a lot about is this is flu season. And so, it's really important to get your flu shot. I don't know how many of you follow the flu trends, but I definitely do. And last year there was basically no flu season, which is unheard of. We always have a flu season. And because there were so many actions being taken to close schools and everyone was wearing masks, the flu was completely, which is a very good sign that the infection prevention measures we took were very effective. The experts are predicting this year there will be a much bigger flu season because schools are open again, people are going to travel more, they're seeing loved ones, they're congregating indoors. So I really want to emphasize the importance of getting your flu vaccine. The flu season starts now, I think officially October 1st, but really this is the start of flu season. So please take the time to get your flu shot. And what I've seen, again, I'm not a doctor, so I want to always caveat that, but what I've seen is that the guidance doesn't say you have to separate the flu vaccine from the COVID booster. If you are scheduled to get one, you could get both. It's certainly your own choice, and certainly you can always ask your primary care provider if you want any guidance on it. But it's something that, you know, if you want to kill two birds with one stone, it's not contraindicated to get both vaccines at the same time if you're in the eligible population. And so I think those are important things to share. I also want to just mention a couple other safety precautions we're taking at the hospital. We test all of our patients before they have surgery or procedure to make sure that they're not COVID positive before they come to get that surgery or procedure done at the hospital. We are restricting visitation. So we have a number of visitor restrictions that evolve as the CDC, CDPH, county, everybody gives us new guidance. And so if you're ever wondering what our latest visitor policy is, you can go to our website and it's always up to date and it has the latest information so that you can know. But basically at the highest level, one thing I want to make sure everyone's aware of is California Department of Public Health issued a public health order that anybody who's visiting a patient in the hospital, like an inpatient in the hospital, must either be vaccinated, like fully vaccinated, or have a negative test result from within the last 72 hours in order to be able to visit their loved one in the hospital. And that's something that all hospitals across the state of California, we're all held to that same standard. And as you may have seen, there was another public health order specifically about employees being vaccinated. So all healthcare workers as of September 30th must be fully vaccinated, or they are eligible for an exemption if they have a religious or medical reason, but then they have to provide some documentation to support that. So as of September 30th, you know, that'll be fully effective. Our vaccination rate in the hospital as from employees is very, very high, well over 90%. And so we're well on track for our September 30th deadline. And I think that that's another step that, you know, we're taking to make sure that patients and community members are safe when they come to the hospital. Having been working in the hospital throughout the COVID pandemic, I will say that I felt very safe because we all know how to use protective equipment. We all know we're all very comfortable wearing masks and we take it very seriously. And so I just want to reassure everyone that, you know, the hospital is a very safe place to get healthcare done. And the last thing I want to mention about healthcare in particular is that we've seen a drop in preventive care over the last 18 months. Children have not gotten all the vaccinations they needed to get. And, you know, your annual mammograms have been put off, colonoscopies have been delayed, things that need to happen just to keep the rest of, you know, the population healthy. And so I really want to encourage you to please, you know, continue taking care of your health and looking out for your symptoms if you have any issues, because we don't want COVID to cause people to be afraid of getting their other healthcare needs taken care of. And I'll wrap up by saying that I am so grateful to the community. I've never felt so much support and embrace from the community as we've had over the last 18 months. People have really rallied around our healthcare workers and have been so supportive of our frontline staff. They really are heroes. They deserve so much credit for everything they've done. And I know many of you have personally, in the organizations you're a part of, have really reached out to support them and to thank them for their work. And I just can't thank you enough for that. It's really been an inspiring thing, and really a testament to the amazing population that we have in this community. So thank you, and I'm happy to answer any questions.
So you pretty much answered every question that I had thought of asking you, because that's top of mind. So that means you're very tapped into what the community is asking, what the community wants to know. So really appreciate it. Anybody from, you know, wants to type a question in the chat or wants to unmute and ask, you know, you're welcome. But while we're waiting for, you know, anybody else to ask a question. So, and how do you, you know, along with what's happening with COVID, what about some of the other surgeries and things like that and health issues that people might be running into? Like, are they coming to the hospital for that, or you're seeing a low?
Yeah, well, I think that one of the things I've been concerned with is I've heard from a number of physicians who come to bring patients to the hospital who put off taking care of their healthcare needs. You know, they may have noticed a lump in their breast and they've waited a while to actually make the appointment because they didn't really want to go to a doctor's office or didn't really want to go, you know, to all the follow-up care that they instructed them to have. And then when they actually do come, the cancer or the other, you know, whatever condition it is, has progressed a lot farther. And really prevention or early detection is so, so important. And certainly as we're coming up on Breast Cancer Awareness Month in October, I do want to make a plug specifically about that too. Annual mammograms, going to your doctor when you have any questions, doing self-checks, that's so important. And I think that people have been so afraid of COVID, and for good reason. It's a very scary, situation, but they're so afraid that they may be ignoring something that's actually happening to them in their own health, or hoping it'll go away rather than addressing it. And so we've seen that the severity of the patients who are coming to us is higher because of the condition in that patient, because they waited longer than they needed to. And similarly with, emergency room visits, for a while we saw a major drop. Now I think it's kind of back to where it's normally been, but I think that people sometimes say, I'm feeling this pain, but I'm going to sit it out and wait and see what happens. But you do have to listen to your body. And what we found sometimes is someone waits a long time and then it's a much worse condition. So I really want to encourage people to listen to their own bodies. And when you have a concern, don't just ignore it. You're your best patient advocate. You're the best advocate for yourself. And if something doesn't feel right, go look for an answer. And that's really important to do. So hopefully that answers the question. I see a question in the text box also about when those under 12 will be able to get vaccinated. I know that those studies are very well underway. What I'm hearing is that by Thanksgiving, a lot of the children under 12 will be able to get vaccinated because of the authorization for the 5 to 12-year-old population. I'm not the expert in that necessarily, but it sounds like there will be a lot of access to the vaccine within only a couple months for the 5 to 12-year-old population. I think it sounds like it'll start with Pfizer, and then Moderna is going to follow suit. I should mention on the boosters that Moderna is working on getting the boosters authorized as well, but they haven't reached that step yet. So I think within not too distant future, Moderna will also get some sort of authorization for boosters. And I've also heard that Johnson & Johnson has done some research that is proving that a booster is a very effective as well for kind of improving a level of immunity. So more information is probably coming soon on the Johnson & Johnson as well.
Great. So I think one of the other questions I had is, this is a global pandemic. Obviously no CEO, probably it happens in a lifetime for anybody. How do you, are you keeping an eye, San Ramon being a very diverse community now, our numbers came out with the census, and we've got a very diverse population. That also means families traveling in and out. And, this is almost, touches that global aspect. Do you see families that are coming and seeking support at the hospital? They're coming from outside the country, visiting their children or their parents and things like that?
I think that's always been a part of our population. I think that we are a very global community, and we have a lot of members of San Ramon's community who have family from abroad. And so that isn't necessarily a new thing that we've seen, but we've had patients who come to our hospital who are visiting loved ones in the community. That's always been a part of who we serve as a population here. And we really enjoy being able to serve anybody who comes through our doors. And we do have translation phone line services, and we have a really diverse workforce as well. So we're able to accommodate, patients who come from down the street or from the other side of the globe who are visiting their loved ones. I think that when you're traveling, you're also generally sometimes more vulnerable to getting sick. Sometimes you're eating foods that you're not used to, or you're doing activities that are not the norm, or you're experiencing a lot of different, your life is not the traditional, day-to-day experience when you're traveling. And so there are more chances that you might need healthcare because you might get sick. And so we're very accustomed to seeing patients from other communities who are visiting. In fact, we've also had patients who end up, who are pregnant, who are visiting, and they may end up delivering in the hospital unexpectedly because they were visiting family and they were from originally Arizona, and all sorts of interesting situations. But we're here for patients regardless of where they come from.
Awesome. And that brings me to another question, which everybody talks about: whose kid was born in San Ramon Regional? So do you know how many babies we had last year at the hospital?
I don't remember last year in particular, but I know on average it's like 440 is kind of like an average number per year. So about a little bit more than one a day. What we do when we have a baby born in the hospital is we play a lullaby overhead so everybody can hear that a baby was born, and everyone goes on, gets all excited when they hear it because it's a special thing and the parents get to press the button to play it overhead. We're really proud of our labor and delivery program. They have really high patient satisfaction. Almost every year they get recognized by Bay Area Parent Magazine for the services they provide to families. And I think, you know, when I meet people in the community, most of the time when they talk about the hospital is because they know someone who was born there or they were born there. We have a couple of our employees were born at the hospital, and certainly a lot of our employees, when they choose to have their babies, they also choose to have them at the hospital. I think actually for me, that's one of the most meaningful things is when our own colleagues and team members choose to come to the hospital for their own healthcare needs, because they really feel like they're being taken care of by a family. And so that's really special. And we want to take good care of everyone, but it's really exciting when we have our own employees at the hospital for a delivery or some other healthcare need.
That's awesome. Anybody else have any question? You know, we do want to make it conversational, and, you know, Ann is here and she's giving us her time. So if you're curious about anything about the hospital, feel free to either unmute and ask a question or type it in the chat and we'll read that.
Yeah, I have a question.
Yes, please go ahead.
Yeah, I'm from Houston, Texas. My name is Mohammed Ansari. I was vaccinated with Moderna, and the booster is not available yet. Do we can get the Pfizer vaccine instead of Moderna?
It's a great question. So there is no requirement that if you got Moderna in your first round, you have to get Moderna in the second round. It is very much open to the individual. So Pfizer is authorized for anybody who meets the criteria. So the things I mentioned before, over 65, immunocompromised, or works in a high-risk setting. The only kind of time frame requirement is after 6 months of the first doses. But if you got Moderna first time, you can still get Pfizer this time. It's up to you to decide if you want to or not. It's not, there's no restriction on it.
Okay, I hope there's no interaction with the old vaccination with Pfizer. Also, the vaccination for the children, it has been field tested or not? Because like I have my nieces, they are maybe 6 years old, 3 years old. How safe it is to get them vaccinated?
So my understanding is that the clinical trials are well underway for a lot of these different populations from 5 to 11 years old. For both, well, certainly for Pfizer, and I believe Moderna is also underway for that population. So, I can't say yet whether it's, going to be approved for sure, but it does seem like all the signs indicate that it's going to be authorized and approved. And the FDA takes this responsibility very seriously, so they wouldn't authorize or approve anything that isn't safe for those that age group. So once they give that approval and authorization, first authorization, then approval, it means that it's safe for the population. But I always encourage people, if they're not 100% sure, if they have questions, it's good to talk to their pediatrician, or for example, pregnant women have had a lot of questions about the vaccine. So it's recommended that they talk to their OBGYN just to make sure that, if there's something specifically about themselves that they want to understand how it may interact with the vaccine, it's good to have that conversation. I should mention also that I've seen a recent study that women who are pregnant when they're vaccinated are able to transmit the antibodies to their newborn child, which is also, I think, encouraging for potential or prospective mothers, because babies are not going to be vaccinated in this new, even when it's approved up to 5 years old, the under 5 population is still not going to be eligible. So this is a way for the baby to have some level of immunity by receiving the antibodies from the mother.
Thank you for answering the questions, and it's a very informative discussion, and we hope we get rid of this COVID pretty soon.
I hope so too. I'm ready for us to be a part of our history, not our present.
Yes. Thank you, and I just leave now. Thank you for listening to you. Have a good day. Bye-bye.
Oh, thank you. I do see a question about, does the COVID vaccine cover the Delta variants? The COVID vaccine that's currently being utilized, and I should mention this too, the booster shot is still the same formulation as the original vaccines that we all received back in the spring or the winter. It's not a new formulation. So the current vaccine was developed before even existed, and it was designed for the kind of what they call it the wild type, but it's the original version of COVID-19 and the virus that was in the community back last year. Unfortunately, there are some elements of the Delta variant that are not so when they, sorry, I should step back. So when they developed this original vaccine, it was very, very effective against the original variant of COVID. But this Delta variant, unfortunately, has some attributes to it that make it so that it's not quite as defended from by the vaccine. It's still very helpful. The COVID vaccine still does really provide some level of prevention, and it certainly also reduces the level of severity of illness, but it doesn't prevent Delta as much as it prevented the original version of COVID. Unfortunately, the Delta variant is very highly transmissible. So if you take a sample of all the viruses that are currently circulating, the original wild type is very, very small now. It's almost negligible in the community, and Delta has really taken off as the majority of the variants that you're finding in the community of the virus. And so people who are vaccinated can still catch the Delta variant. But if they do catch it, what we're finding is that the level of severity of their illness is lower, and they don't necessarily require hospitalization, and the disease doesn't last as long or take quite as much of an impact or toll on the individual as if they're unvaccinated. So it's still really important to get vaccinated, even if this virus is not exactly what's being targeted by the vaccine. I know that every time there's a new variant, you have to basically map the new variant and work on potentially developing a vaccine against that new variant. Really, I think that the hope is that there will be almost like a pan-coronavirus vaccine in the future that will be able to block many different types of variants, because the variants keep on emerging, and it's hard to say kind of what the future will hold. I think that to a certain extent, we're in this period of still learning a lot about how the evolution of this disease is, and whether it's going to be with us as an endemic part of our communities, and whether we're going to have to treat it almost as an annual vaccination process. That remains to be seen, and I would defer to the immunologists and experts on that long-term outlook. But for now, I think that it's still really, really effective and important to get the vaccine, because if you do catch it, you're still going to be in a much better position to not end up in the hospital and on a ventilator. And that's really what's most important.
And then there is another question, which I'm also curious about, that if somebody has had COVID, do they need do they need a vaccine? Do they already have antibodies and, kind of are the same as somebody who's been vaccinated? Have you heard anything? Can you share something there?
I'm not, again, the expert on this, so I'm not going to claim to be, but my impression is that when someone has COVID, as it catches COVID, they do develop antibodies, but I don't believe they last as long, and you're not protected for as long as with the vaccine. So somewhere what I've heard is that it's about a 90-day antibody period where you're really protected against COVID after you've been infected, whereas the vaccine is lasting 6 months or longer. So I think that having had COVID doesn't provide the same level of protection. And my impression is that the number of antibodies is higher with the vaccine than it is with the infection, but I'm not 100% sure. So I don't want to cite that necessarily. But what the scientists are recommending is, even if you've had COVID, you should still consider getting vaccinated. And you don't want to necessarily get it the first day, but you should be getting it once you've recovered from the infection. Consider getting vaccinated just to boost the level of immunity and the lasting effect of the immunity that you would have against the disease.
Wonderful. So, Ann, I know you do a lot more in the community than just serve as the CEO of the hospital. And would you like to share some of the other community organizations that you're involved with and some of the great work you're doing here in the San Ramon Valley?
Oh, that's very, very kind of you. I do want to put in a plug specifically for Leadership San Ramon Valley. I'm on the board of Leadership San Ramon, and they're a phenomenal organization that really helps individuals in the community learn about opportunities for leadership. They learn about how the whole community works. They learn about what contributes to a healthy community. I think that a community like San Ramon doesn't have success by accident. It's a very intentional process, and it takes the effort of a lot of different community organizations to create this safe and diverse and culturally supportive environment for individuals of all ages. And so I see that people like it too from the community. Great. So I'm a big fan. I'm from the class of 2013, and I've learned so much about what city government does, about what resources are out there, all the amazing not-for-profits that are also in this community contributing to its richness, learning about the education system, even just the infrastructure. How do parks work? How does all the, behind the scenes, the city's economics, all of that is really important to understand, so you can be a very informed citizen and also contribute back to the community. So if I have a chance to plug an organization, that would be one that I would certainly encourage anyone who's an interested member of the community to consider applying. We just started our class this year, and it goes from September, well, I guess it started in August, but it goes from the fall all the way until the spring of the following year. We have a class once a month, and during that class, we talk about a different topic. So Cultural Arts Day, City Government Day, community economics, healthy communities, and we'll have a lot of really phenomenal guest speakers tell you about that element of the city's richness or just the community as a whole. And by the time you graduate, you really have a very deep understanding of what it takes to make such a vibrant place as our Tri-Valley area. So I'd really encourage you to consider joining if you haven't had any exposure to it. It's a great organization.
Well, thank you for sharing. I'm a graduate of 2016, and I know exactly, what you mean it's a San Ramon Valley leadership. So we get connected with not only, leadership in San Ramon, but Danville, and kind of as a San Ramon Valley. And it's a phenomenal program, really connects you, like you said, with all the different things that are happening in the community. And so, yes, I have to agree with you. Wonderful experience.
Yeah.
Any other boards you serve on and provide your leadership?
Well, I think that I recently joined the board of an organization called Cirrus Corporation. It's a company based in Concord. And what they do is they safeguard the blood supply to make sure that when we're providing transfusions, they are as safe as possible. Basically, what they do is called pathogen inactivation. As you can imagine, especially we're all aware of with the latest pandemic, it's very important that when we are providing blood transfusions to individuals, that we are not inadvertently passing on a communicable disease to them. The last thing you'd want to do while you're trying to save someone's life by giving them a blood transfusion is also transmit, HIV, for example, which was a huge problem back in the 80s and 90s. And so this company has developed an amazing technology that is able to prevent the transmission of pathogens through blood transmission or transfusion. And so that's something that I'm very passionate about. I really care about the safety of healthcare and making sure that patients are getting only benefit from being in the hospital or benefit from their healthcare, not any adverse risks or future problems. And so it's really important to be a part of that. So I think that's one that I'm excited about as well, just because it's so close to home, and we do transfusions in the hospital every day. And there's so much. What I think I love so much about healthcare is that behind every single action we take and behind every process we follow in the hospital, there's so much science and so much history and so much research and best practice that's evolved and developed over decades to be able to ensure that that's a safe process. And so I've enjoyed learning about, some of those processes behind the scenes, so we can really, make sure the patient who's in that bed doesn't have to worry about all of that or think about where it comes from, and just know that this is the best thing we can do for them in that moment.
Well, thank you for sharing all of that. I really appreciate everything you do to serve the community here, and we're really, really proud of you, and really excited that San Ramon Regional is here. Another thing which Eva had mentioned, that you also take Kaiser. So sometimes Kaiser, people might think they have to go to Kaiser Hospital, but I guess San Ramon Regional takes Kaiser insurance as well, which is good to know.
So it's a complicated arrangement to explain, but basically for a number of years, we've had an agreement with Kaiser where we're able to designate a number of beds for Kaiser patients. I think that, and certainly I should mention that you can always come into the emergency room of any hospital, regardless of what insurance you have, because in the emergency department, you just go to the closest one and then they'll take care of you regardless of whether you even have insurance or not. That's not an issue. And certainly Kaiser patients are welcome to any emergency room, and ours is very much included. Our agreement with Kaiser, I think, may be coming to an end at the end of this year, but we're always hopeful we can continue having that agreement with them, because it's really convenient for patients in the community not to have to drive so far for care if they need something locally. So we've been really glad to have that relationship for a long time.
Robert has shared, not COVID related, but a shout out to San Ramon Hospital. I had my first heart attack a few years ago and ended up with a stent. I was very well taken care of at this hospital. Good job, San Ramon Regional.
Oh, I hope you're doing well, Robert. Thank you for sharing. It's funny because nobody really wants to be in the hospital. It's unless you're having maybe a baby, but it's usually a very scary and stressful time. And so, our goal is just to make it as pleasant as possible and for you to not have to worry about anything except getting better. And so I'm really glad to hear that. And I hope that's what we can continue to offer for another 30 years. I would mention we turned 31 this year, and you probably heard this already, Sabina, but we were so excited because we were turning 30 last year and we were going to make a big deal out of it, and then COVID hit, and so obviously that just kind of went to the wayside. But I do think that, as we've reached 30 now, or 31, as a hospital, we really care about making sure that the community knows we're going to be here for another 30 years. We're really passionate about, the being a part of this community that we care so much about. And so we're very grateful for the community's support, and look forward to serving you any way that you need in the future as well.
Thank you so much. And I just wanted to, the last few minutes, we generally wrap up in about 45 minutes. So with the last few minutes, I wanted to say thank you to everybody for joining this. I've been doing these community conversations since January now, and this is our 9th conversation. I really hope that, soon we'll be able to do this in person within local neighborhoods, go to a local restaurant, support a local business, and have gathered the community there. But in the meantime, I think till the end of the year, we'll continue doing this on Zoom, and you can always register. We do it on we meet on the last Saturday or the Sunday. One of the reasons is, sometimes some folks can join on a Saturday because they have church on Sunday, and some folks can join on Sunday because they have their kids' practices on Saturday. So we try to give, and then it's always broadcast on Facebook as well, and we'll make sure we're putting these recordings on YouTube too, so that folks can watch this as needed. We've had an amazing panel of panelists that have joined me, and I'm very, very fortunate to know such amazing folks in the community, and that my serving on council has really allowed me to build these partnerships and serve everybody better through these partnerships as well. I also want to put in a plug for some of the events that are happening in San Ramon in October. Historic Foundation is having an Oktoberfest at the farm. So that is going to be 2nd October. Then there's a Culture in the Community celebration happening on October 17th. I believe if you if you would like to participate, there might still be an opportunity for you to submit your booth. I know we are such a diverse fabric of communities that live in San Ramon, and we love to highlight those and really bring them out in the Culture and the Community celebration. So that's a great opportunity. The San Ramon Symphonic Band Fall Concert is happening on October 17th at the Doherty Valley Performing Arts Center. And they're really following all the, COVID related, rules that are coming down from the county, wearing masks and making sure whatever's in place is implemented there. And then it looks like the holiday boutique presentation by San Ramon Senior Foundation is also happening. So anything else, any other event that I might have missed and you guys want to share, do let me know. And we actually also have community input and feedback that we're trying to gather for our planning purposes for the future. So I don't know how many of you have heard this, but I know we had a presentation on our RENA numbers, and we are being asked by the state to have a certain number of housing come to San Ramon. And we really want to, even though this is, it's a balance between housing and growth, we do want to make sure that we have input from our residents as we plan out San Ramon for the next 8 years. And where would you like to see housing? We have a lot of input around the downtown area, building smaller houses, more of a walkable, bikeable community that we're imagining as the future of San Ramon, while we're protecting our hills and kind of the outskirts of our community. So please do give your input. It's called, I believe, plantsanramon.org, where you can put in give your input and let us know where would you like and how would you like the future of housing in San Ramon. It is a big topic for the state. It's a big topic for the communities as we balance between homelessness and affordability and some of those things which are big topics as well. We want to make sure, we are being inclusive of everyone. So with that, I'm always available. You can reach me, through the multiple social media channels I have out there, through my city email, or my phone number is listed as well. And just want to say thank you to everybody for joining us today, and special thanks for Ann for taking the time on a Saturday morning to join us for this panel. Have a wonderful Saturday, and I will see you around. Thank you.
Thank you. Thank you.
Bye.
Bye.